In the August-September edition of OT, which is landing on the 3rd of August, we explore the public perceptions of eye care, what it currently is and what some people are doing to improve those perceptions. One of the people we spoke with is Dr. Grant Robinson, Senior Lecturer at Cardiff University and an IP optometrist.
The shift in the perception of optometrists in Wales, I think, started a long time ago with the advent of the Wales Eye Care Service and the Low Vision Service Wales, which really changed what optometrists were offering and formalised what optometrists could do for patients in the community. And since then, there has been a steady evolution. Other services such as the independent prescriber optometry service, which was launched during the pandemic, and the ophthalmic diagnostic treatment centres offer new avenues that the public can experience more clinical care compared to what optometrists were previously able to provide in Wales.
The 2024 GOC Public Perception Survey showed in Wales that 43% of people would go to an optometrist as first port of call for an eye problem, rather than a GP, which is up from 39% last year. So how do we keep this trend of improvement going?
I think the next step in changing public perception really is working at an interdisciplinary level with GPs, pharmacists and other healthcare providers to really ensure that everyone is aware of what optometrists can do and what patients really can be signposted to optometrists in the community. I think if we level up that aspect of things, and we level up that work with our colleagues, then certainly we can further change public perception. There is a responsibility for healthcare providers in communities to talk to each other about this. I think some of the onus should be go and speak to pharmacists and GPs, for example, in the community and take that responsibility on yourself to do it. The involvement of the professional bodies with regards to that, to give it a greater push, would certainly be beneficial too.
What has been happening lately to supercharge the improvement in the public perception of optometry?
So during the pandemic, I would say it was the advent of the independent prescriber optometry service in Wales that was the main driving force between changing public perception of optometrists here, particularly in South Wales. So what that did is it formalised a pathway by which non-IP optometrists in Wales would refer to their IP qualified colleagues if they felt that their patient required therapeutic management. And those patients would have otherwise been referred into the hospital eye service. So they were being kept out of the hospital eye service and they were being treated in the community, and the success was huge. And so much so that that service has evolved and somewhat been incorporated into the new GOS contract here in Wales. And as a member of the general public, if you're able to get treatment in the community, if you're able to get a script for whatever ophthalmic drugs you need from the optometrist and take it to your local pharmacist, then that is going to actively change perception.
Looking toward the future, what factors do you think will influence the public view of optometry?
So the contract, I think, will change public perception of optometrists in Wales. I think that the contract provides better remuneration, but also highlights what optometrists with higher qualifications can do in the community. And it's also resulted in more optometrists enrolling to study towards higher qualifications. So it's going to change the workforce, I think, in Wales. We're going to have a workforce that will have more IP optometrists in the future and more optometrists with subspecialties. And then the benefits that they can convey to the general public will go some way into changing the public perception, because the benefits will include management, monitoring, treatment of people in the community as opposed to referral on to secondary care. So I think then that will lead to optometrists being seen more as healthcare providers as opposed to the retail aspect of the role.
Grant also walks the talk. He became IP qualified himself. We wanted to know, why did he want to become an IP qualified optometrist?
A few years ago, I had a phone call from my mother who had a painful red eye. I advised that she go see the optometrist as soon as possible. The optometrist referred her into the hospital eye service, and unfortunately, the eye service was quite congested then, so she couldn't be seen until the following day. So she had quite a traumatic night with a painful red eye as she waited to be seen. She was diagnosed with viral keratitis and provided with a script to take to the pharmacist the next day. When she did get the treatment, that was great. It started to work. And her follow-up was actually performed in the community by an IP optometrist. And the difference that made for her was incredible. The whole process was far easier, far more efficient for her. And she and I are really thankful for the care of that optometrist in that instance.
Would you recommend IP training to others?
It's diversified my role, and it's given me something even more interesting to do on top of what I already considered to be the interesting role of an optometrist. It's given another facet, and I would consider it to be a privilege to be able to do this, because I can provide much better care to my patients now than I could before I was IP qualified. And you can tangibly see the difference it makes to people, because the kind of patients you tend to provide prescriptions for, you need to review more readily than just standard eye examinations. You tend to see them on a regular basis, and you can see the difference it makes to them a lot more, and the difference it makes to not only them, but their families as well. And I benefited from that firsthand after the experience I had with my mother's eye problem being treated by an IP optometrist.